Hello everyone, Rob Guillory here with CNS Occupational Medicine. At CNS Occ Med, we want to stay in front of the concerns that many Americans face when handling their health in the workplace. Today, I want to talk about a topic we're all too familiar with, COVID-19. Shockingly, it's already the third summer since COVID hit us all by surprise, which has included the rise and fall of many variants. The most recent is BA.5. So let's hit on a few important points as this variant continues to spread. BA.5, the most recent subvariant of SARS-CoV-2, has proven to be stealthier at evading people's immune defenses than previous variants. Since Omicron's quick rise and fall, other highly transmissible variants are becoming the dominant strain. These variants are also highly transmissible, though not presently as deadly as the original COVID variant. Regardless, this summer's fun diminished as the fog of more COVID fears spread and employers deal with more lost productivity from sick employees. Since the highly transmissible Omicron variants spread across the US, in some cases evading immunity from earlier infections, many are wondering, are they eligible for a second booster? And if so, when? So, who's eligible for which shots and what do we know about what's ahead? BA.5 is now dominant and getting boosted is important. Last week, the subvariant caused almost 2 out of every 3 new COVID infections in the US, according to data from the CDC. For those who are not fully vaccinated but boosted, experts say many are overdue as people with prior infection, even with BA.1 and BA.2, are likely still at risk for BA.4 and BA.5. Everybody over the age of 5, unless you just started getting vaccinated, should have had at least 3 vaccines, a primary 2-dose series, and a booster. It may not seem like a very big deal because vaccines and better treatments have dramatically cut the risk of death from COVID-19. However, we are still seeing about 300 to 350 people dying on average each day from COVID-19. As of March 29th, the FDA and CDC have approved a second booster for healthy adults 50 and over that are 4 months past their first booster dose. Additionally, those over 12 years of age with weakened immune systems are also eligible for a second booster shot. Looking at the data, 4 doses of the Pfizer vaccine were 30% more protective against infection than 3 doses. This protection was 11% for Moderna vaccine. According to preliminary data from the CDC, adults under 50 had the highest rates of COVID-19 cases compared to other age groups as of the end of June. U.S. health officials have been in active discussions with the Food and Drug Administration on whether the agency will authorize a second booster vaccine for Americans under 50 years old. Americans can also help bring down the levels of circulating virus by getting tested when experiencing symptoms, after being around someone who's symptomatic, or after being in potentially high exposure scenarios like concerts, sporting events, or similar scenarios. The question remains, will there be a new vaccine in the fall? Conversations continue to swirl about a vaccine combined with flu shots, a bivalent or multi-strain vaccination, and other similar alternatives to the current formulation of COVID vaccine that has not changed greatly since inception in 2020. What can employers do today to protect employees? As COVID-19 becomes endemic or part of our community environment, employers must be prepared for future variant waves and annual prevention. But how? At CNS Occupational Medicine, we offer services to contribute to your company's return to work plan, including in-clinic or in-office Pfizer and Moderna COVID-19 vaccine and boosters, in-clinic or in-your-office flu vaccinations, 98% effective laboratory-confirmed COVID-19 PCR tests, and 96% effective rapid antigen tests, and pre-hire and pre-shift screenings. Meet your business health needs and keep your employees healthy and safe with CNS Occupational Medicine. For more information, contact us at 800-551-9816 or info@cnsoccmed.com.